This afternoon we were delighted to host a conference on the health effects of prostitution here in the INMO Head Quarters. We had speakers from the health services for persons involved in prostitution, from UHAMA, from the Immigrant Council of Ireland, and a particularly inspiring contribution from Muia Deficha, a survivor of prostitution. The aim of today's seminar was to bring to the fore the horrendous immediate and long-term both physical and mental effects of prostitution, to reiterate to the public that it is simply not a choice and a matter of consent, that people are forced into this situation or enter this situation and can't find a way out of it. Furthermore, we felt it was very important, and particularly Mia's contribution brought to the fore, that buying a person for the purposes of sexual gratification is a dehumanising act, and it is not to be normalised through legalisation. The government have produced the Heads of Bill, which will decriminalise those involved in prostitution and recognise them as a victim, and criminalise those who purchase sex, thereby dealing with the demand. In addition, we need to enhance the penalties against persons who organise prostitution and who are spearheading a multi-million euro criminal empire in this country. In reality, this legislation needs to move from Heads of Bill forward to full legislation and to be enacted this year. On the 1st of June in Northern Ireland, legislation will be enacted which will decriminalise those involved in prostitution and criminalise those purchasing persons. We cannot have a situation where on two sides of the border on one island a person involved in prostitution is recognised as a victim north of the border and as a criminal south of the border. People involved in prostitution suffer violence, they suffer severe mental health effects, and they are dehumanised by their experience. This is something we need to support them to leave, and it is something we need to criminalise so as to deal with demand.